When it comes to the science of how we should interact with other people during the COVID-19 pandemic, the rules are pretty clear. 6 feet of social distance, mask on, outside is better than indoors, and wash your hands. But when it comes to human psychology, though, these interactions, they can get a whole lot more complicated. People have different perceptions of danger, different tolerances for risk, and different personal boundaries. And as we all tiptoe our way out of isolation and back into each other's lives, we're going to need to figure out a way to navigate these murky interpersonal interactions, whether they're with coworkers or family or friends. Laura Murray is a clinical psychologist and senior scientist from the Department of Mental Health at the Bloomberg School of Public Health, and she's on the line with us now to share some practical wisdom on the subject. Dr. Murray, thanks for being with us.
Pleasure to be here. Thank you so much.
So for starters, Dr. Murray, say you've got maybe a friend or a sibling or someone in your immediate world who doesn't seem to be taking COVID-19 seriously. They say it's overblown, it's no worse than the flu. How do you have a productive conversation with that person and come to some sort of mutual understanding?
Yes, it's a tough question that we're all working our way through these days. There's a couple of things to keep in mind as you proceed down that path. One is it really depends on your relationship with the individual, how open your communication is, how able your relationship is able to sort of withstand some back and forth. Second of all, you really want to take some time to be aware of your own thoughts and emotions before you go into the conversation. I say that because I myself have walked into conversations and lo and behold, I realized, gosh, I'm actually angry at them that they did this. This conversation does not go very well. So really taking some time to say, what's my goal here? How am I coming into this situation? And then one of the basic things we know about communication is it's always better to come and try to understand the other's perspective. So talk to me about, why you did this or why your stance is this on COVID. I just want to sort of understand. And it's been interesting taking some people down that path, and they actually have learned that it might come out of fear or it might come out of loneliness or a place that they maybe didn't expect. And then the other thing that we have said is sometimes a common response is that people are unsure because there's been so many different messages, different circumstances across different states, different family situations. And so maybe offering to sort of share what you know from science. We know that a lot of people are getting information from social media. We know that a lot of numbers are up and down and all over the place. It sort of depends where they come from. And so we really are trying to get people to also just share scientific information.
How much more complicated does that conversation get, Dr. Murray, if the person you're talking to is like your own mom or dad?
Yeah, it is a little bit of a different dynamic, isn't it, when we're speaking with our parents? And I think one thing is really to come to the table understanding that many people come to that conversation really at a baseline out of love and concern for that person. But what often happens in conversations, if we don't take the time to understand that about ourselves, is that we come with frustration. How could you go to this restaurant? What are you doing? How can you not do this? And so again, just really asking them, why did you feel like that was, something you wanted to do? I'd like to understand that better. Or just really making sure you use I statements. I'm actually very concerned and I'd like to talk to you more about different ways that you can function or get around and things like that.
Here's one for you. Say you get an invitation to, some kind of a formal event, like a friend's wedding. They're kind of expecting you to go. You feel the social pressure, but you just don't feel safe going. How do you respond in a situation like that?
Yeah. And boy, isn't that common? Sporting events now are getting back into action, dinners out. And you gave the example of a wedding. And oftentimes it's helpful to sort of make sure you say, gosh, I feel particularly bad about this because it's your wedding. And I understand how important that is. And really trying to understand it from their perspective also, what they're trying to do, what they're trying to manage and still go on with life in the context of 2020. So share those I statements. Don't try to, over-rationalize your decision. Really stick to those feelings that it comes from, that I feel concerned or I'm in this particular situation. One of the things we say also about just working with friends with events is to not only be honest, but really make sure you've got a statement in your pocket of like, I know we may not agree on this, but I hope we can still be friends. Because I think what we're seeing now is people are in different situations and they have different perspectives on safety. And so just being okay to throw it out there that I'm okay understanding that you and I feel differently about this, and I hope that doesn't really impact our friendship.
Let's turn to the workplace. Say your company has made the decision for everyone to head back in full-time to do in-person work at the office. What if you're an employee in that situation? The social distancing and mask rules are in place, but you look around and you see coworkers basically ignoring the rules. How do you think about that environment? How would you speak up for yourself without creating, office drama, conflict, or ill will in the process?
Or for some, the fear of losing a job or getting furloughed because they feel this way. Work it's a complicated environment that you want to keep in mind a number of things as you proceed forward. One, what's your role in the company? Are you doing something that could be done from far away versus not? How much is that going to impact sort of being in the office versus not? Two, I think you really want to look at your leader and the organizational structure and the climate. So we talk a lot within organizations about psychological safety and sort of how much your workplace has an environment of opening it up to honest feedback. And unfortunately, you do have to keep those things in mind because we're also dealing with livelihoods. And so we like to say that transparency is always best. Again, I think an approach with your boss or organization coming from the I, not saying, I'm not going to come in, or this is crazy that you're having us come in, but really an I statement of, this makes me feel nervous or concerned because. So really take the time to lay out that argument. When I often work with people, I have them practice. And that's because the first time we say things like that, especially when we're nervous about it and it has to do with our job and we're in that type of environment, our emotions just swell up, whether we like it or not. So practice, rehearse your lines, and go in and sort of open that discussion and maybe come to a compromise.
Lastly, before I let you go, Dr. Murray, what if you are a parent of kids who are looking at the prospect of heading back into the classroom for in-person learning sometime soon? When that time comes, how do folks help their kids understand the risks and the dangers without, psychologically scarring them and scaring the daylights out of them in the process?
Yeah, I'm so happy you brought up kids because I think kids and teenagers and college-age kids, they really are going through this process also with us. And the first thing I would say is you really want to pay attention to development, how you would interact and respond and help a 5 to 8-year-old is very different from a 16 to 18-year-old, is very different from someone who's maneuvering their way through a university system. So one of the things that we really are trying to encourage is keep those lines of communication open with your kids. Talk about the frustrations that you have and the challenges you have, and maybe even add some humor. We're all going through this. We're all uncertain. To make sure that they feel like this is an environment where they can bring their frustrations honestly and they don't have to hide them. And I think just being open about your concerns and making sure you're not sort of conveying a whole lot of anxiety and fear on them, but letting them know that this is why we're asking you to wear masks. And we know it's hard to stay away from, your friends 6 feet apart, that that's really hard. And I think as adults, we have to keep in mind their developmental level, right? Gosh, could you imagine being a teenager or, young adult and having someone just say you have to stay away from all your friends? This is a very social time in these kids' lives developmentally. So just us recognizing, too, that this is hard for them maybe in different ways. So ask a lot of questions, really try to listen, enhance that communication.
Dr. Laura Murray is a clinical psychologist and senior scientist from the Department of Mental Health at the Bloomberg School of Public Health. And Dr. Murray, thanks for your wisdom and thanks for taking the time to be with us.
Thank you so much for having me.